Hello friends. Today I will talk about something that can save your money. That means your hospital bills from thousands to lakhs. So what is that thing? You must have heard and you must have experienced yourself that when you go to your physician or a surgeon, they usually ask about the diseases which are unrelated to your present problem, like whether you are suffering from some cardiac problem, whether you are suffering from some diabetes, some thyroid problem. So many such diseases which are already there and you are taking treatment for that. So what is the significance of asking all these conditions? So today I will discuss when you go to a surgeon and you are advised some surgical procedure. So you don't think that these diabetes, this hypertension, cardiac problem, thyroid problem, these are so important in a surgical procedure. So many times you intentionally or intentionally don't tell to your surgeon or your anesthetist doctor. So what happens? So today I will talk specifically about the people or patients who are suffering from hypothyroidism. That means they are having low level of normal thyroid hormones in their circulation. That means their thyroid gland is not secreting proper amount or adequate amount of thyroxine hormone in the circulation. So for that they are taking external thyroxine to compensate the low level of thyroxine. And this thyroxine hormone is responsible for your metabolic activities and many other functions. So what will happen if you don't tell your physician? If you don't tell your physician, that means on the day of surgery when you are kept fasting, so nobody will give you that thyroxine and you yourself think that I am on a fasting, so why should I take that medication? So here is the problem. Here is the main catch. Sorry. So when your surgical procedure is being done under general anesthesia and you have not told your hypothyroid problem to the physician, to the anesthetist, and you have not taken your thyroxine that you usually take early in the morning before breakfast. So during surgery it will not cause any problem. But problem occurs when anesthetist tries to wake you up from the anesthesia. In that case your metabolic rate or metabolism is so low that for the excretion and metabolism of your anesthetic drugs take a lot of time. So that means in that case anesthetist may not be able to revive you from anesthesia to a conscious state as in a patient without hypothyroidism. It may take few hours, it may take 24 hours or 42 hours. So what will happen during that time? Because when you are not out of anesthesia, you will not breathe spontaneously. For that, to keep you alive, anesthetist have to put you on ventilator. When the patient is on ventilator, he or she cannot be kept in a ward. He or she has to be kept in ICU. Now you can understand the bill of the ICU that range from 50,000 per day to 1.5 to 2 lakhs per day depending upon the hospital and the condition of the patient. So you were before surgery, you were advised that your hospital bill will be 50,000, 75,000, and when you are discharged, your hospital bill will be 3.5 lakh, 4 lakh, depending upon how long you have stayed in the ICU on ventilator. So simply by telling this condition that you are taking thyroxine, anesthetist will advise you and give instruction to the sister in charge that this patient should be given thyroxine in the morning before the surgery being done. In that case, your metabolism will be all right, and excretion of the drug, that is anesthetic drugs, will be in a normal time, and anesthetist will revive you or will wake you up in a normal time. So that way you can save your bill, you can save your complications, and you can also save the time of the hospital and the resources of the hospital also. Thank you very much. Please don't forget to subscribe my channel if you want to know other such valuable things and valuable information in future. Thank you very much.